Welcome to today's session. Today we will discuss about some psychiatric illness and their treatment. Okay, now we're moving on. At first, see, in the left hand side there are diseases and the right hand side the treatment of those diseases. Okay, at first, PTSD or post-traumatic stress disorder, depression and OCD means obsessive compulsive disorder. What is the treatment of these three? SSRI means selective serotonin reuptake inhibitor. What are they? Like escitalopram, which is most important or most commonly used drug. Okay, then plus CBT means cognitive behavioral therapy. So in case of PTSD, depression and OCD, we can use SSRI and CBT. SSRI means I have said selective serotonin reuptake inhibitor and cognitive behavioral therapy. Okay, now acute mania, severe mania and mania in pregnancy, antipsychotics. In pregnancy, antipsychotics are safe. We know there are mainly two types of antipsychotics, typical and atypical antipsychotics. In case of typical, there is like haloperidol, and in case of atypical antipsychotics, there is like olanzapine like drugs. Okay, quetiapine. Okay, now next slide. For bipolar disorder, what is bipolar disorder? It is mixture of mania and depression. We use antipsychotics and lithium lamotrigine. Mainly in case of mania, we use antipsychotics, and in depression, lithium and lamotrigine is better. Now, anxiety disorder. There are two types mainly. Panic attack means it is uh, not long lasting, and GAD means generalized anxiety disorder. It is long lasting. What are the treatment of it? BZD, or we will start treatment with the benzodiazepine group of drugs like lorazepam, diazepam like drugs, and then we will shift to SSRI if BZD, if the patient is not responding to BZDs. Okay, and the cognitive behavioral therapy will go on side by side. We commonly say counseling, psychiatric counseling to the cognitive behavioral therapy. Okay, now next slide. Phobia. For phobia, we use BZD. Then if it doesn't work, then we'll go on to the SSRI, and BT or behavioral therapy will be there. For phobia, there is behavioral therapy, and we have said in case of anxiety disorder, there will be CBT or cognitive behavioral therapy. It is very much important. Okay, now very important psychiatric disorder, schizophrenia. In case of schizophrenia, we will use D2 blocker and 5-HT2 blocker together. Atypical antipsychotics, sorry, atypical antipsychotics are better than typical antipsychotics. Atypical antipsychotics means olanzapine like drugs, quetiapine like drugs, and typical like your haloperidol. Okay, so atypical antipsychotics are better in schizophrenia. Now, some alcohol-related disorders. I have said it. I have said it. Sorry, I have mentioned in the one common heading, that is alcohol withdrawal. Okay, at first acute alcohol withdrawal, we will use BZDs or benzodiazepine group of drugs. IV lorazepam we can give. Okay, now Wernicke's encephalopathy, we will use IV thiamine. Okay, Korsakoff psychosis, we will give oral thiamine. Delirium tremens, we will use BZDs plus thiamine. In our OPD or ward, some patient comes with delirium tremens, we will give IV lorazepam plus thiamine is given, mainly IM. Now, for alcohol aversion, disulfiram is given. Some drugs may act like disulfiram. These are known as disulfiram-like drugs, like metronidazole. Okay, so don't take alcohol and metronidazole together. Okay, now some anti-craving drugs, acamprosate and naltrexone. Okay, now opioid poisoning. Opioid poisoning. In case of acute opioid poisoning, we will give IV naloxone and replacement therapy, MENTA. Okay, replacement therapy, we will use methadone, buprenorphine and naltrexone. Naloxone for acute phase and naltrexone. Trexone is The name is longer, so we will use it in long term or for replacement therapy. Now, the two disorders, anorexia nervosa and bulimia nervosa. We will use behavioral therapy plus SSRI or selective serotonin reuptake inhibitor. Now, the last slide. For narcolepsy or sleep paralysis, we will use modafinil. Modafinil. Sorry, the spelling is wrong. Modafinil. Okay. And for ADHD, what is ADHD? It is attention deficit hyperactivity disorders. Okay. It is mainly seen in children, mainly in school going age group. We will use methylphenidate for this. Okay. Thank you for attending the session. The PDF will be available in the comment section or in the description. Thank you.